Hey everyone, it's good to see you again. So here's something that affects millions of Americans right now. The government's new update on Medicare open enrollment. It might sound routine, but this year it's anything but. And here's something most people don't realize. Starting next year, Medicare plans will include a $2,000 cap on annual out-of-pocket prescription drug costs. That's one of the biggest changes to the program in years, and it could save many people a lot of money. So yeah, this is one of those topics you really don't want to tune out on, because what you learn here could make a real difference for your wallet and your healthcare. Before we get started, I'd love to know, what's the one thing you worry about most when it comes to your Medicare or healthcare coverage? Is it cost, coverage, or maybe just trying to understand all the options? Let me know in the comments below. So, let's start with what's actually happening right now. Medicare open enrollment is underway, and it runs through December 7th. This is the one time each year when you can review your plan, make changes, or switch between different types of coverage. And even if you think your plan is fine, here's the truth. Things change every single year. Doctors may leave your network, co-pays can increase, and benefits that used to be included might quietly disappear. You might not even notice until January, when it's too late to fix. According to Dr. Mehmet Oz, who's now the administrator of the Centers for Medicare and Medicaid Services, he put it pretty simply. Sometimes these policies change without you knowing it, and you'll have a worse experience next year if you don't check. And honestly, he's right. Insurance companies make adjustments every year. They can raise or lower premiums, change provider networks, or tweak prescription drug coverage. So yeah, even if you're happy now, it's worth taking a fresh look. It could save you hundreds, maybe even thousands. Now, here's where things get a little more serious. The average Medicare Part B premium, that's the one covering outpatient services and doctor visits, is expected to rise next year. It currently averages about $185 a month, and it could go up by around $20. That might not sound like much at first, but for someone on a fixed income, that's real money every month. Meanwhile, the good news is that some Part D plans, those are your prescription drug plans, may actually see slight decreases in premiums. And Medicare Advantage plans, which bundle hospital, doctor, and drug coverage through private insurers, are expected to stay stable or even drop in cost for some enrollees. But here's the thing, it's not just about the price tag, it's about value. Because cheaper doesn't always mean better, especially if your doctor isn't covered or if the medications you rely on are suddenly more expensive under a different plan. I've heard from viewers before who said they woke up in January to find their doctor was no longer in network, or their copay for a heart medication doubled. And when you're retired, that kind of surprise isn't just inconvenient. It can throw off your whole budget. So what should you do? Well, the first step is to grab the letter your current plan sent you. It's called the Annual Notice of Change. Every plan has to send it out before open enrollment. That letter outlines exactly what's changing for next year. If you didn't get it, call your plan and ask for a copy. Look carefully at any differences in your premiums, copays, deductibles, or medication coverage. If anything feels off or you're unsure, it's a sign to start comparing options. And speaking of comparing, Medicare's website actually makes it easier than you might think. If you go to Medicare.gov, you can plug in your prescriptions and even your favorite pharmacy to compare plans side by side and estimate what they'll cost next year. Just keep in mind, the doctor network listings aren't always perfect, so it's a good idea to double-check directly with your provider before making your final choice. Still, it's one of the most helpful tools for avoiding those January surprises. Now, another thing that's changing, and this is big, is the government's approach to drug pricing. The administration introduced what's called the Most Favored Nation model, which essentially forces drug companies to charge Americans the same or similar prices they charge in other countries, like Canada or Germany. In the past, Americans often paid 2 or 3 times more for the exact same medication. So this move is meant to balance things out and reduce out-of-pocket costs for people on Medicare, especially for chronic conditions that require expensive treatments. Dr. Oz described it well. He said when you buy a drug in America, it's often 3 times higher than in Europe, even though it's made in the same factory. That's what this reform is targeting. And while there's still debate about how much it'll lower prices right away, it's a step toward fairness and affordability. Now, I know some of you might be wondering, what about the government shutdown? How does that affect Medicare? Well, here's what we know. The federal shutdown has now stretched into its third week, and it's added a lot of confusion to an already stressful process. President Donald Trump has been vocal about this, warning that the longer the funding dispute continues, the more pressure it could put on programs like Social Security, Medicare, and Medicaid. He's blamed Democrats for refusing to fund the government, saying they're trying to push through healthcare benefits for undocumented immigrants, while Democrats argue the shutdown is the result of political brinkmanship. The important thing to know is this. For now, your Medicare coverage and open enrollment are not affected. The system is still running, and you can still make your plan changes through December 7th. But it does highlight how politically charged these programs have become. Medicare isn't just a healthcare issue anymore. It's a central topic in national politics, tied directly to how we Just pausing for a moment to share something important with you. We've partnered with Chapter, a service we feel confident recommending for clear, honest Medicare help. They'll connect you with a licensed advisor, compare every Medicare plan in your area, and help you save money. Most people save around $1,100 a year. It's free, and their care advocate team is there to support you even after you're signed up. Call 615-639-1937 or visit askchapter.org/money using the link in the comments below. Fund the government and balance the budget. So, what can you control right now? The answer is simple: your engagement. You can't control Washington politics, but you can make sure you're not overpaying or missing coverage because you didn't double-check your plan. And there's something else new this year that's worth paying attention to. Some Medicare Advantage plans are expanding their supplemental benefits. That means they can offer things like help with groceries, transportation to doctor visits, utilities, or gym memberships. Those are real, tangible perks that can improve quality of life. But again, those benefits vary by plan and location. So check carefully to make sure those offerings actually apply to you and that they're not just marketing fluff. You know, one of the most common messages I get from people around this time of year goes something like this: I just don't know where to start. And I get it. Medicare can feel confusing. Between the letters, parts, premiums, and plan types, it's easy to feel overwhelmed. But here's the truth. You don't need to know everything. You just need to take one step. Look at what you have, make sure it still fits, and if not, make the switch. That's it. If you're new to Medicare this year, you actually have a bit more flexibility. First time, enrollees often get a longer window to choose or adjust plans. But don't wait. Even though the tools are better now, there's still a learning curve. And if you're not comfortable using the website, the 1-800-Medicare hotline is still staffed by real people who can walk you through your options. Now, there's a quick public health note that's been circulating recently that Dr. Oz also mentioned: some new research about acetaminophen use during pregnancy and possible links to autism. It's not a proven causal link, but there's growing evidence suggesting caution. His message was simple: if you don't need it, don't take it unless your doctor advises otherwise. That kind of transparency is becoming more common in public health messaging, being proactive instead of reactive. If you take away just one thing from this today, let it be this: engagement matters. Medicare isn't set it and forget it. The system gives you tools, but it's up to you to use them. December 7th is the deadline. And after that, you'll be locked into your choice for the next year. So take a few minutes this week, grab your paperwork, hop online, or make a quick call, and make sure you're getting what you deserve out of the plan you're paying for. And if you've ever had a bad experience with Medicare, maybe a doctor dropped out of your network or a prescription suddenly costs more, share that in the comments. Your story might help someone else avoid the same problem. Thanks for watching, take care, and I'll see you in the next one.